Afternoon. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Today is the 9th day of May 2021. Today is a very special day. Today, globally, mothers are celebrated, especially for one reason, for being the savior of our world. So thank you for coming to today's open clinic. Remember, we have specific clinics for the group for specific days. Every Sunday about this time, 12 p.m. Eastern Time, US, and 5 p.m. if you're in Nigerian time, we normally have a kind of a meetup. I will normally select a topic, teach the topic, then take a couple of questions from the floor. But today is a very special day. Today, we're going to devote today to all mothers in the group. Now, remember, all the women in our group are mothers. The moment God made you a woman, the moment you became XX inside your mother's womb, you're a mother until proven otherwise. So if you're a member of our group, whether you have your baby right now, whether you're pregnant right now, whether you've had a long-term infertility, whether it's short-term infertility, you are a mother by default. That's who God made you to be. So today we are celebrating all mothers, and you happen to be one of them. Now, I want you to appreciate the fact that you rock. You rock, you matter, okay? So regardless of your current situation, of your current status, it's temporal. So whether your babies are with you right now, or whether your babies are going to come later in the year, or your babies are going to come in 2022, you are a mother. This is a blessed assurance. So every singular mother in this group, I have special privilege to have known you. I have special privilege to have had you as my audience. So thank you so much for saving our world. Thank you so much for being the light in our community. Mothers are everything we want in our world. Mothers are the reason why our world is still together. Without mothers, without women, we won't have a world. The world would have been a very dark place. So women rock. So let's use this opportunity to appreciate all women, all girls, all ladies, especially the strong ones among you. So thank you so much for coming today to Maternal and Child Health Clinic. Today's clinic is going to be pretty much open clinic. So I don't have a topic. It's going to be a special edition of question and answers from all mothers. So remember, you are a mother. As I'm talking to you right now, it's possible it's 20 years, you're still waiting to actualize your motherhood. It's possible it's 15, it's possible it's 10, it's possible it's 5, it's even possible it's just 1 year or even 1 month. So far as I'm concerned, from what I know, you are a mother. So thank you so much. I appreciate you. Now, when you come in, please do me a special favor. Today is a very special class. So I want you to introduce yourself specially. When you're introducing yourself, I want you to do one quick, simple thing. I want you to mention all your babies. So if your babies are currently with you as we talk, like if I want to introduce myself, my name is Dr. Chudi Ufondu, the father of Chizara Ufondu, the father of Chidumeje Ufondu, and the husband to Chichi Ufondu. I reside in Florida, in America. This is how I'm introducing myself. So I'm a father to Chizara Ufondu. I'm a father to Chidumeje Ufondu. And I'm also a husband to Janet Chichi Ufondu. Now, I want you to do the same thing. When you come in, don't just tell me your Ngozi. Let me know who is Ngozi. I want you to mention the names of your babies. I want you to mention the names of your baby now. I want you to mention the names of your babies now. So if you have babies already as we talk, I want you to put a mother in front of your name. So like Chi Evelyn, I know she has 3 boys. So Chi, when you're introducing yourself, I want you to introduce yourself like, my name is Chi Evelyn. I'm the mother of so, 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 and so. So I want you to put the names of your babies as you're introducing yourself. Now, if your babies are not with you physically now, I want to challenge you. I want you to call forth your babies. So call their names. So if you are in our believing for baby category today, that means you're going to become a mother, either later this year or first quarter of next year. The women that will become mothers in 2021 are women that are already pregnant. So if you are already pregnant in January or sometime in February, then the possibility you're going to actualize your motherhood in 2021 is there. If you are yet to become pregnant, the possibility is going to be the first quarter of 2022 is there. But please, let's start today on a very high note. So please, when you're coming in, follow the simple instructions. Introduce yourself. Tell me your name. Tell me the names of your babies. The names of your babies you have right now, and the names of the babies you're going to have this year, or the names of the babies you're going to have next year. And this is not a coincidence. On the 30th of this month, we are going to host a multiple pregnancy roundtable. Now, if you're believing God for twins, I want you to mention the names of your twins. So if you're going to have David and Deborah, I want you to tell me, my name is Chichi. I'm the mother of David and Deborah. My name is Emeka. I'm the father of David and Deborah. I reside in Lagos. This is exactly how I want you to introduce yourself. When we are done introducing ourselves, once I have the number 50, I'm going to open the clinic. Normally, the clinic is supposed to last for 45 minutes. But because it's a special edition today, because of Mother's Day, I'm going to have a 1-hour interactive section with every single person. So if you know any of your friends who needs help, who is going through difficulties, who is having infertility problems, this might be a template for them to get the help they need. So please, let's all do this. Let me take a roll call. Please, when you come in, introduce yourself the exact way God made you. So if you have your babies around, please, I want you to introduce the names of your babies. If your babies are still going to come, please, I also want you to introduce the names of your babies. Very important. Please follow this instruction. It can change your life for good. So let me see who is in attendance. So I have Doris Ugochi. I don't have a location for you. I have Ada. I have Chiazoka. I know Chiazoka is in Boston. Chiazoka, what about your babies? Please, I want you to introduce yourself properly. Dussel Inans, please, every single person in attendance, when you come in, introduce yourself. Introduce yourself with, I'm the mother of the names of your kids. If you're going to have twins, please introduce yourself with the mother of the names of your twins. If it's twin boys, I want you to name them. Coincidentally, today is Sunday, and today is a special Sunday for special people. It's Mother's Day. We're going to say our prayers. We're going to take you to God, and God will be God, and you will see this to come to pass. This too shall pass. The names of the babies you're going to mention today will come to pass. Okay, so let's quickly get this introduction knocked off so I can open the clinic, and we can all have, our time, and everybody can be good. So please, when you come in, introduce yourself. I'm still looking for the names of the babies. I'm still looking for the right introduction. Okay, so here we go. I'm a mother to Chimamanda and Chigoziem Justin, a wife to Justin. You reside in Imo State. Thank you so much. Your introduction is not complete because I need to know the area. I need to know this town in Imo State. So Chi is a mother of 3 boys, Chukwe Buka, Chidubem, and Chidumeje. The last boy is actually the same name with Dumeje. Okay, so thank you so much. Chiazoka, my name is Chiazoka Osuji. I'm the mother of Audrey Chuma Osuji and the mother of Kosi Sochukwu Okemdenachi Chukuma. So that's Chiazoka's twins, and it's going to happen. It's going to happen. Doris is a mother to 3 babies, so keep introducing yourself, every single one of you. When you come in, please, even if you've completed your family, I need to know better. We need to reclaim our right. We need to reclaim our inheritance. So I need you to tell me the mother of who you are. Okay, so let's continue, guys. Quickly get this introduction done so we can get the clinic started. So Daisy Carlo, thank you so much. You're from Togo. Ugo Glory from Newi. Okay. Bemisola from where? It's not listed. Your name is Chamaka. And okay, Christabel, please follow simple instructions. Your location and the names of your babies. Okay. Okay, so guys, I have my numbers and I'm going to open the clinic now, and I want you to start asking your questions. The clinic is open. It's a special edition for Mother's Day. So what you need to do is to ask simple, straightforward questions. In the next 1 hour, we're going to have an interactive section. So you ask me questions, I give you feedbacks. I want you to reactivate your faith today. Remember, the registration for the multiple pregnancy roundtable is going to happen. So if you don't have your twins right now, physically, I will challenge you to go and register for that event. Today is Mother's Sunday. If you don't have your baby physically today, your babies are there. This is when to activate your faith. Part of activating your faith is getting the knowledge you need. So I'm challenging you to enroll for the ground table, multiple pregnancy roundtable. So many people are going to get pregnant. And suddenly, the day you will go for your scan, instead of seeing one heartbeat, they will tell you, madam, you know what? It looks like we have another 2 heartbeats. That's triplets. You might be going for one baby and they might call you and they might tell you, babe, mother, it looks like you have 2 more heartbeats. That's twin babies. And 4 people are also possible. So what I want you to do today is to recharge yourself, is to reclaim it. Thank God today is Sunday. Look, what I'm telling you is what I believe. If you don't believe this, it's not going to happen. Faith is the evidence of the babies you're calling their names today. And the substance. So when you go back to your home in 2022, you will hear the cries of babies. You will stay up night to feed your babies. It will happen. But I want you to faith it out. So proclaim the names of your babies today as a Mother's Day gift to them. Call them forth. So they will come forth because God has already said that you're going to be a mother and nothing can stop you. So I want everybody in attendance to do this. It's very important to do this. Once you're done doing that, please start asking your questions. The clinic is open. Remember, we have a couple of platforms. If you're in YouTube, please make sure you follow us on YouTube. Click on like, subscribe, share. You can comment. Then please make sure you subscribe. It's very important. Everything we do is out there in the open. So make sure you're in the YouTube. If you're in Facebook, make sure you're in our page. Make sure you're in our group. Make sure you're in my timeline. So you have 4 different platforms to participate in today's event. So if you're in YouTube, thank you so much. Ask your questions. I will see them. If you're my friend in Facebook, I will see your question. If you're in our group, I will see your question. If you're in my page, I will see your question. So those 4 platforms, except Instagram. Over time, we're going to add our Instagram. You will have opportunity to get your feedbacks today. But please, when you come in, please introduce yourself properly. Today's clinic is a special event, is a special recognition to all mothers. And I'm telling you that all women in this group are mothers. Whether you like it or not, you're a mother. So I want you to call forth the names of the babies you're already having and the names of the babies you're going to have. I want you to mention their name. I want you to tell me you're the mother of the names of the babies you're going to have. Okay, so the clinic is going to open now, and I'm going to take care of your questions. Okay, so guys, ask your questions. It's open question and answer, special edition of Mother's Day Open Clinic. So please go ahead and ask your questions. Okay, so the first question says, hello, doc. You had a missed abortion in February 2021. You found out again you're pregnant. Hope it's not too early. Should you start taking your folic acid? Now, when I get this type of question, it doesn't really make me happy. And I will tell you why. You see, Chiamaka Okoye, I don't know how long you've been following me. I've been coming out since 2015. Now, you are not doing the right things. You see, the problem is we just want to get pregnant. But we don't plan ourselves. Then we begin to have problems. Now, I'm going to talk to you directly. What you're doing is not the right things. You had missed abortion in 2021. This is February, few months ago. Now, missed abortion can happen to any lady. In missed abortion, for some reason, your baby will stop developing, but you're not going to show the signs of abortion. So you're not going to bleed, you're not going to have pain, but your baby is no longer developing. Your baby is dead inside your womb. That's what missed abortion is. Missed abortion can also be called miscarriage. So in medical practice, abortion and miscarriage is the same thing. Now, you had this in February. Now, what did you do when you had this? Now, let's even start from when you became pregnant. No, let's even start from before you became pregnant. I don't know if you're a new member, but before you became pregnant, the gold standard for all believing for baby mothers in this group is to do what? To take your prenatal multivitamins. You are supposed to start taking it 3 months before the period you are anticipating you will become pregnant. So if you're going to become pregnant in January, it's expected you would have started taking it in October. So you would have taken it October, November, December, 3 months. Then you're supposed to take it 3 months into the pregnancy. So that period of 6 months is very critical to proper development of your baby. Now you've had miscarriage, which it can happen to any woman. February. Now you are pregnant again without planning. And now you are asking me if it's not too early to start taking folic acid when you are supposed to have started taking it. You see, when we show up and we beg pregnant women to attend our ANC, it will look like I have special interest. But it's for your own good. It's for your own baby. Now you've had miscarriage. Any woman that had miscarriage is a risk factor. If the reason why you had the miscarriage in February is not properly attended to, it will repeat itself again. Now, the fact you're not taking your folic acid again means you're not in the right track. You are supposed to have started taking your folic acid. Now, after the miscarriage you have, we are supposed to have checked to make sure you don't have retained product of conception. So we're supposed to take an ultrasound and make sure that all the contents of your baby is completely expelled from your womb. This is gold standard for all women who have miscarriage or stillbirth. Remember that the difference between miscarriage and stillbirth is 20 weeks. If you unintentionally lose your baby before 20 weeks, it's termed miscarriage. After 20 weeks, stillbirth. Now, every woman that has lost her baby, very painful experience. After crying, you need to go back to your doctor. We need to examine. We need to check the level of your hormones to make sure it has come back to normal. Then you need to give yourself a break. Now, let's count February to May, March, April, May, already 3 months. It's possible you fully recover, but you're not doing the right things. You are supposed to have started taking your prenatal multivitamin immediately, but you're not taking it. And I can guarantee you're not in our ANC. And you're asking me questions openly. And the possibility you might have another miscarriage is very high. So please, do the right things. You see, becoming pregnant is one thing. Having a smooth pregnancy is another thing. The best way you can ensure that your baby at least will be okay from the things we can prevent is to attend your ANC. Your ANC is to look after you and your baby. So Chiamaka, you didn't do the right things. You can still redeem yourself. So admin can set you up. You can join our ANC group in our lounge in Telegram. It's optional. But I'm currently recommending that all pregnant women, especially if your pregnancy is classified as high risk, please register for ANC. It will help you. Now, go and run. Don't walk. Run and start taking your prenatal multivitamins immediately. Make sure it contains adequate amount of folic acid, 400 to 600 microgram of folic acid. Start taking it immediately. Take it for the whole duration of this pregnancy. Now, please go and register for ANC immediately. You must be careful. Some miscarriages we can prevent. But if you don't know what to do, or if you know what to do, but you're being a smart Nigerian, you're going to have another terrible experience. I don't want you to experience that. So you are late. It's important I call you out, because the problem is we don't want to hear the truth. We only want to show up and people that will tell us what we want to hear. Then when something begins to go wrong, you begin to cry, things we could have prevented. So please be a good mother and register for ANC and start taking your prenatal multivitamins immediately. If you happen to be in the same position with Chiamaka, mend your ways. Change your approach to your pregnancy. Pregnancy is a very delicate thing. It takes a lot to be a mother. Please be careful. Okay, so if you need to register for the upcoming Super Masterclass in multiple pregnancy, please follow the admin. The admin has shared the links. What you need to do is to follow the steps. I want you to register as early as possible. We have only 100 slots. Once we get to 100 mark, we will close registration. It's going to be one of the best events you've ever attended. Why? We have 2 lady doctors trained in Nigeria. One practicing in America here, the other one practicing in Nigeria, and myself. So we're going to have 3 subject matter specialists to deconstruct everything about multiple pregnancy. Now, I'm going to tell you this with all confidence. So many people are going to become pregnant and they will have twins in this group. So many people are going to have triplets. So many people are going to have quadruplets. The only tiebreaker is your faith. So if you can decide to be courageous, to step up from your comfort zone, and you say, Doc, I'm going to do everything you tell me to do, you are going to become a mother of twins. You are going to become a mother of triplets. You're going to become a mother of quadruplets. By this time next year, it would have been 1 year. It takes 9 months to become pregnant and conceive your baby. You are not going to be alone. But I'm challenging you today to come out from your comfort zone and do the right thing. The difference is knowledge. When you acquire the right knowledge about multiple pregnancy and you change your attitude and you change your practices, there is no woman out there who can't have multiple pregnancy. Any woman at any time can have 2, 3, 4 babies, but you have to follow the process. Okay, so I will encourage you to attend. If you want to attend, please register early and please make sure you follow the instructions. Once you're done, we're going to add you to the group and tell your friends. The best gift you can give your friend is to show them the way. So if you have some people you genuinely love and you want to help them, because what we do when we are rising, we lift each other. So when I'm up, I want to pick you up. So if there are people you love so much and they are looking for babies, you can also sponsor them. Likes of Chiazoka, she does it every year, every month. She sponsors 10 people. You can also go and sponsor 10 people. You can tell them to come, or you can tell us and we can recruit them. But for any reason, don't share the blessing alone. Help other women that are going through difficulties. Okay, so guys, let's keep taking care of your questions, okay? Correct, when you come in, please mention the names of your babies. What makes one see her period every 2 months at 43? This lady, Gifty. Now, when you are getting older, the possibility you're going to be having irregular period is very high. So your question is, what makes her to see her period every 2 months at 43? So that means your period is now reducing. So I want to know the details. Do you used to have 5 days, now you're having 2 days? Or do you used to have 2 days, now it's only 1 day? Or whichever way, I want to know the details. And I can't know the details if I don't know your medical history. And I remember in the past, I've advised you to subscribe. Now, age is a big factor. So the older you get, the more the likelihood you're going to have irregular period. When your period becomes irregular at 43, it's possible you're getting ready for menopause. Now, it can be weight gain, it can be weight loss, it can be hormone imbalance, it can be a couple of other issues, which I wouldn't know. So what I will tell you to do is to subscribe, and we can evaluate and see what we can do for you. But my sister, you're 43. And you should be one of the regulars in this group. So I'm sure you know the right things to do, okay? So guys, let's continue. Let's continue. After you're done introducing the names of your babies and yourself, please ask your questions. Ask your questions. We still have about 30 more minutes to take care of your questions. Okay, guys, keep asking your questions. If you need to subscribe to talk to me, it's possible. You can come in for 1 week. It's called Light. You can come in for 1 month. It's called Basic. You can come in for 3 months. It's called Classic. And you can also come in for 6 months. It's called Prime. So whichever one that works for you, please quickly come in so we can fellowship and we can see what we can do to defeat infertility. But until then, keep asking your questions. Okay, so I'm going to go down and I'll see what I have. What drugs should a 1 month pregnant woman take when she can start her ANC? You are not supposed to take any drug by yourself. What you are supposed to do at 1 month pregnancy, you're supposed to enroll for ANC. When you go for your ANC, we do what we call baseline investigation. So we take your blood, we take your urine, we check your height, we check your weight, we calculate the baseline, then we give you a series of appointments. Every pregnant woman must have 3 different confirmations: your urine, your blood, and your ultrasound. Once we've done the ultrasound and we've confirmed that the baby is completely developing in the womb, then you're good to go. Now, there are a couple of standard medications and drugs we can give you. in your pregnancy. If you're in Nigeria, we're going to give you anti-malaria prophylaxis. So all pregnant women in Nigeria will be treated for malaria, whether you have the malaria or not, because you are in malaria endemic region. Now, some women can also be given some blood tablets. Some women will also, not some women, all pregnant women will be given their tetanus shot. So these are only standard things you are supposed to have when you're pregnant. So once you are confirmed pregnant, stop taking drugs by yourself, including your painkillers, including your antibiotics. You have to confirm from your doctor. If your doctor tells you to take it, continue. If your doctor didn't approve it, please don't take it. You can harm your baby. Okay, so let's continue, guys. Let's continue. You've been treating yeast infection in pregnancy using clotrimazole pessaries. It keeps coming up again. What can you do? Now, the question is, are you attending your ANC who diagnosed the yeast infection? So if you're not doing that, you need to take yourself back. Now, for some people, if the candida infection, which is also called yeast infection, or which is called candida albicans, I'm not going to confuse you with the medical terminology. It's a fungal infection, right? You can have it anytime. Now, remember that when you're pregnant, your immune system is depressed. So there are a couple of things that can happen. Now, you need to present yourself to the doctor. There are specific antifungal treatment we're going to give you. Some people can have stubborn fungal infection. We can either increase the dose, or we can change, or we can combine. So in your pregnancy, first of all, for us to know that you have candida, you have to go through an ANC doctor, because candida infection can also present like UTI. It can also present like sexually transmitted infection. So you need to go back to your ANC doctor immediately. Okay, so let's continue, guys. Please don't take any drug by yourself in pregnancy. It's not the right thing. You can afford to do self-medication when you're not pregnant, but once you become pregnant, you are a different kind of person. Do not take any drug without getting approval from your doctor. Very, very important. Okay, guys, let's continue, guys. Let's continue. Let's continue. Keep asking your questions, please. Keep asking your questions. Okay, so I'm going to continue going down. I'm looking for questions. Okay. Now, remember, if you're in Abuja, if you're in Asaba, if you're in Awka, Benue, Calabar, Enugu, Jos, Kanu, Kogi, Lagos, Nnewi, Osun, Owerri, and Port Harcourt, we can refer you to SGHS certified, verified, experienced, evidence-based fertility specialists. These are the people I can interact with, and by the grace of God, we can help you to become a mother or a father, okay? So let's continue, guys. I'm going down, so if your questions have not been answered, you can ask them again. How can one stay after removing IUD? Do you mean how long? So here's the deal. IUD is one of the most reliable long-term contraceptive, right? Now, when you remove your IUD, IUD stands for intrauterine device. It's long-acting. When you remove it, anytime you are on any contraceptive, when you stop using it, there's a latent period of infertility that will last before your fertility will come back. So I believe they've told you this when you went for your appointment. Okay, so you need to piggyback to your provider, and you need to follow up with your family planning. So when you remove your IUD, some people, their fertility can quickly bounce back within 3 months. Some people, it might be 6 months. Some people, it can be immediate. Actually, some women can become pregnant when they are on IUD. Few women though. So there are different fertility indexes for women. So please piggyback to your gynecologist. Okay. Let's continue, guys. Keep asking your questions, please. What are the recommended prenatal multivitamins to be taken 3 months before becoming pregnant? There are so many prenatal multivitamins out there. If you're in Nigeria, the popular one is Pregnacare, but there are so many good ones. What you need to do, go to a very experienced, very reliable pharmaceutical shop in Nigeria. When you walk in there, ask to speak with a pharmacist. When the pharmacist comes, it's over the counter. The pharmacist will take you to the section for prenatal multivitamins. The pharmacist will give you the ones they have. Now, your duty is to read through the label and make sure it has adequate contents of folic acid, which is 400 to 600 microgram. When you get that, you continue taking it until you deliver. But make sure you start taking it from 3 months before you became pregnant, and at worst, 3 months into your pregnancy. So that period of 6 months is very important. But if I were you, I would take it for the whole duration of the pregnancy. So that's what you need to do. Okay, you had miscarriage in 2015. And since then, you've been trying to get pregnant. So unfortunately, you're having secondary infertility. So what you need to do, you and your partner will need to see a fertility specialist. So we need to know why. 2015 is a very long time. That's 6 years ago. So we need to know where the problem is coming from, and we need to know what to do. But in the interim, I hope you're practicing your PPP. The first P is praying. The second P is consistent lovemaking every 48 hours. The last P is practice, which is what we are doing today. Registering for your masterclass, getting the PDFs, going to your fertility specialist. When you do all this, you will increase the possibility of becoming pregnant. So that's what you need to do. Any woman in our gathering who is above 35, when you have done your best for 6 months and you're not getting result, you are classified as having infertility. At that point, you need to begin to seek help. Don't tell me you're only praying. Don't go about saying amen. Put in the works. Prayer without works will give you nothing. Some women will pray all the prayer points. Some women will fast and do a whole lot of things, but they are not making love. Some women will be waiting for their ovulation when you're not even sure you're ovulating. So for whatever reason, please make love every 48 hours. It works. It will blow your mind what's going to happen. Okay? Let's continue, guys. Let's continue. Admin is doing an amazing job. She's sharing all the packages. Remember, if you are pregnant, we have a special group for pregnant women. It's called our SGHS ANC Lounge. It's in our Telegram. When you go there, you will join other pregnant women. Now, if you are believing to be a mother, by next year, latest, we also have a special group for you in our Telegram. When you get there, you can interact with other women. Then you can have an opportunity to get feedbacks to your questions. Very important two groups. Okay, so let's continue, guys. Okay, someone is asking about how you can treat taking the endometrium. There are things you can't treat by yourself. So if they told you you have taken the endometrium, it's expected that it was a gynecologist that did that, right? So you need to piggyback. We might likely give you some hormonal drugs. We might likely take you in for some surgical corrections. So you need to go back to a gynecologist. There is nothing you can do by yourself. Anything related to the cover of your womb, which is called the endometrium. Some women can have thin endometrium. When you have thin endometrium, the possibility of pregnancy happening in the first place is limited. Some women can become pregnant, but they can miscarry because your endometrium is supposed to be a particular thick level before you can succeed in having implantation. Now, if your endometrium is thicker than expected, then you need to go back to a gynecologist. Okay, so let's continue, guys. Let's continue. Keep asking your questions. Okay, if you haven't introduced yourself properly, please remember to put the names of your babies. Your babies might be the babies you'll have later this year or the babies you'll have next year. It's expected that every mother would have named her babies. It's expected that every father would have named the babies. If you're planning to have 4 babies, I want you to name them. If you haven't named them, start naming them. When you are praying, remember they are your kids. Make sure you make provisions for them. So many people live in big houses, buy big cars. They are not making provisions for their babies. One of the ways you can make provisions for your babies is to put your resources towards having them earlier than later. So some of you are well endowed. Some of you have the resources to defeat infertility by going for IVF, by going for IUI, by going for donor egg, by going for donor sperm, by going for adoption and going for surrogacy. They are all pathways of becoming mothers. They are all pathways of becoming fathers. So I'm challenging you today to allocate your resources towards actualizing, because every singular lady in this group today is a mother. The only thing missing is the date. God has already answered your prayers. Now it's your turn to get up and go and actualize the dream of becoming a mother. If you are not careful, you will show up next year the same. I don't want you showing up in this group next year as a believing for baby mother. No, I want you to at least be in our ANC next year. That's my prayer for you. Okay, let's continue, guys. Let's continue. Let's continue. Keep asking your questions, please. We have about 30 more minutes. Hello, doc. You need my advice on having fibroid surgery overseas or going back to Nigeria. How do you register? Please follow the admin. Admin is going to set you up. Then you decide. You can come in for 1 week. You can come in for 1 month. You can come in for 3 months, or you can come in for 6 months. Now, I will tell you the common denominator. regarding fibroid surgery. I'm sure you read a couple of news yesterday about an unfortunate incident regarding a lady that died after having myomectomy. Now, medically, myomectomy should be the simplest surgery out there, but there are things that can happen. Now, some women might have been told they have fibroid. Now you are praying and you're casting and binding it, and over time it keeps getting big. Please don't do that to yourself again. Some women might have been told they have fibroid 10 years ago. They didn't remove it. Now the fibroid has become humongous. There are some women that when you see their belly, you think they're pregnant. They might go to a particular church, fake churches. They might tell them they've been pregnant and someone in the village is attacking their babies and they haven't delivered their babies since 3 years. No baby can survive in your womb beyond 42 weeks. What you have is fibroid. Now, the earlier you remove your fibroid, the better. When you don't remove your fibroid, the possibility they will become big is very high. Unfortunately, some women will have humongous fibroid, which will damage the architecture of your womb to the extent that the only way to save your life is to remove your womb. Fibroid is a very deadly thing that can happen if you don't follow it religiously. Now, some women want to become pregnant with the same fibroid. It doesn't make sense. Your fibroid is a stranger. Your fibroid is a visitor. Your fibroid is not supposed to be inside your womb. The only person that should be inside your womb is your baby. So now, if you were told you need to go for myomectomy, do is to make sure that the place you are qualified, experienced, evidence-based doctor, a doctor that has done it before, a doctor that has contingency plan, a doctor that has expertise, a doctor that has numbers. You don't just go to any place. You research, then you are ready. Then please go early. The problem is by the time some women are ready to go for the fibroid is already big. Now, will you rather your womb is removed when you're being stubborn? Or will you rather remove your fibroid and you become pregnant? Now, some women are getting ready for IVF. Meanwhile, they have big fibroids. It doesn't make sense. Or you've known you had fibroid for 6 years and you became pregnant. And because of that fibroid, you had miscarriage. Remove your fibroid, my sister. Okay, so the choice of what you want to do, Martina, is up to you. You can subscribe and we can set you up. One common denominator in our group is that if I'm sending you to a place, I'm sending you to a place I can query. Because this is human life we're talking about. We need to be very careful. Okay, so let's continue, guys. Keep asking your questions, please. Keep asking your questions. Please keep asking your questions, okay? All right. Okay, we have a few more minutes to go. So I'm scrolling down to take care of questions. If you need to subscribe, follow the admin. Admin is going to attend to you. Remember, today is a special clinic for all mothers, all women in the group. You are a mother, okay? So today is a special clinic. So you have an opportunity to interface with me and ask all your questions. Please, sir, can someone with blood pressure take folic acid? Every woman that wants to become pregnant should take folic acid. There is no contraindication. Every singular woman who wants to become pregnant must take the folic acid. You can't escape it, okay? Hi, doc. Why will a period reduce to 2 days after fibroid surgery? So long as your period is within 2 days. 2 days is the lower limit of normal, so it's still normal. Okay, now it's possible that the reason why you had that duration of bleeding is because of the fibroid. So most women that have fibroid will have increase in their bleeding days and increase in the quantity. Some women will even be passing clots. But if you pay attention to your body, the moment you remove your fibroid, you will gain back your life. Some women will have painful sex, painful bleeding, heavy bleeding. Then once their fibroid grows, you begin to get back your life. So 2 days is still within normal range. The problem is when you're bleeding more than 7 days or when you're just bleeding for 1 day. So your 2 days bleeding is still within normal range. The normal range is 2 to 7 days. Okay, so let's continue, guys. Let's continue. Keep asking your questions, please. If you need to consult with me, follow the admin. Admin is going to set you up. And please make sure you do your own part. Okay, your period change every month. Now you'll be 35 by September, please. So please subscribe so we can see what we can do for you. The normal cycle is 21 to 35 days. And if you're 35, you're just at that cutoff point. So any woman at age 35, you're getting ready to become advanced in maternal age bracket. 35 is the cutoff point. When you get to 35, you have to change gear. You have to be in the front seat. You have to be serious. You have to be proactive. You don't have to tell me, Doc, I'm coming. Some women will tell me they are coming by 45. By the time they come back 5 years after, they've gone into menopause. When you've gone into menopause, you can't have your own baby. You need to use donor eggs. That's a fact. And every woman is going to get to menopause. Okay? Every singular one of you is a right, is a milestone you will attend. Okay? And it's a good thing. We are all going to get old. But the world of women, it's completely streamlined. You have to use your opportunities. You have to take your chances when you can. Unfortunately, so many of us spiritualize things that absolutely has nothing with your spirit. There are things you need to live for God. There are things you need to live for Jesus Christ. The ones you can do by yourself, you do it. When you begin to use religion, when you begin to use your faith to cover your inadequacies, to cover your indecision, to cover your smartness, you are the one delaying yourself. So you can be a born-again, spirit-filled, heaven-bound sister, and if you don't take your actions, you can become pregnant. If you don't meet with your partner, you can become pregnant. If your tubes are damaged and you don't step up to go for IVF, you cannot become pregnant, my sister. God can do miracle in your life when you show up. But when you don't show up, how can God do miracles? When you're not making love with your partner, how can you become pregnant? The only person that became pregnant without meeting with a man is Virgin Mary. After that, no other woman in life became pregnant without having intercourse with a man, unless we have assisted reproductive technique. The only other way you can become pregnant without the penis going into the vagina is what? Assisted reproductive technique. But if you want to become pregnant, you must meet with your partner. So when it comes to reproduction, stop spiritualizing it. Stop telling me you're binding and casting something that is staring at you. You do your own part. You don't take it to God. God can do a whole lot of things we can do for ourselves. Okay, so let's continue, guys. Correct. Every pregnant woman must confirm their pregnancy through urine, through blood, and ultrasound. Ultrasound is the clinical evidence that you're pregnant, because unfortunately, some women can be pregnant, correct? But unfortunately, that pregnancy might not be viable. You can have chemical pregnancy. You can have blighted ovum. You can have missed abortion. You can have ectopic pregnancy. They are all pregnancies, but they are not normal pregnancies. For some reason, they are not viable. Like if a baby is developing in your tube is not made in such a way to sustain pregnancy. So we need to cut off that tube and save your life. So very important. You have high prolactin. You've been diagnosed or you've been given different drugs, but still no change. Go back to the gynecologist, okay? Sometimes we need to do a couple of other investigations to see if we can dictate where the problem is coming from. But thankfully, women that have confirmed blood level of high prolactin, there are drugs we can give you to control that. Okay? If you want to subscribe, it doesn't matter where you are. Someone in Germany wants to subscribe. We have a lot of Germans who are clients. It doesn't matter where you reside in the world, you can get help. But please step up. All right. Make sure you register for the multiple pregnancy. There are so many women who might have the only chance in their life to become pregnant and have multiple pregnancy. Last year, a lady in Warri became pregnant by changing her ways, by reactivating her faith. I remember vividly what she said when she came in. She told me, Dr. Chudi, you know what? I've been following you since 2015. This is 2020. I know it's COVID era, but I am so convinced that God is going to do this through you. And I'm going to follow whatever you tell me to do. And I said, are you ready? She said, yes. I said, okay, so what we're going to do? We're going to start all over again, okay? I need your partner. I need to talk to your partner. I need your partner to go for seminal fluid analysis. I need to talk to you guys as couples, because the problem is this. Some people actually have their husbands as the anti-pregnancy in their home. You might be going left, your husband might be going right, you might be going right, and he might be going left. If you guys are not on the same page, if you guys do not agree, you can achieve pregnancy without the support of your partner. It's very important. Now, when I spoke to this guy, completely ignorant guy, so many men don't even understand. So many men have refused to go for their seminal fluid analysis. Meanwhile, the problem is coming from you, and you're blaming the woman. But when I saw this guy, because if you notice, I'm a very stubborn guy too. I defend babies. I defend women. I'm on your side. When I spoke to this guy, it's possible the lady is listening to me. I told the guy, you don't know nothing. You don't know what you're talking about. Young man, I don't care if you've impregnated the whole community last 2 years. I need you to go and get your sperm. And I need you to get your sperm early. And I need you to attend all appointments with this lady. And he obeyed. Initially, the lady confided in me. Oh, who is that guy that is talking like, who does he think he is? I said, I'm Dr. Chudi. I'm the savior of women. Guess what? At 47, she went for her first IVF. She's a mother of twins, a boy and a girl, at 48 this year. Your story, it's going to change when you change. Your story is going to change when you say enough is enough. Your story is going to change by the time you acquire the right knowledge. There are so many twin mothers. There are so many triplet mothers staring at me. Let today's Mother's Day be your wake-up call. Assume your position. This is a promise from God. God made you a woman. God gave you your breast. God gave you your womb for your baby. God doesn't make mistakes. Every single thing that God makes, there is a purpose. So when God made you a woman, God made you a woman to carry your baby. If you understand this part of the doctrine, then you will stop deceiving yourself. If you understand that age is not on your side, if you understand what the problem is, then you can begin to follow the solution. Let me give you an example. Your tubes are blocked. My sister, it's not because you're the worst person out there. There are so many women that had 20 miscarriages, 20 abortions. Today, they are looking for contraceptives. And there are so many virgins who have never had sex and are having primary ovarian failure. There are so many things that happen we can't explain. But when you begin to ask God, when you begin to pass judgment, when you begin to classify people, oh, because you did this, some of you, you will go to some pastors, they will heap it on you. They will begin to look for things where they are not. They will begin to tell us that God said and God did. Nobody can do that for you. You're the daughter of God. Nobody can become your father. You don't need visa to talk to your father. You go down on your knees and you remind God that you promised to make me a mother. This is the day you have to reactivate your faith. Do not allow anybody to deceive you again. What I'm telling you today, you will not understand it. But if you can mark today's date, next Mother's Day, you are going to have your twins. Next Mother's Day, you might not even be able to attend today's event because the babies are going to be crying, because you're going to be breastfeeding them. It's going to happen in this group. It will happen. This might be your only chance. This is May. Every singular woman has 12 opportunities in a calendar year to become pregnant. Once you miss your chance, you begin all over again. Some of you might enter menopause by the end of this year. What are you going to do when you've used all your eggs? Are you going to tell me you're going to come? Are you going to spend your life alone? That's not the purpose of God for you. There are so many things you can do. And I'm challenging you today. You might not know me, but I know you. And the message I'm giving to you today is not my message. I'm just telling you what I know. And what I know has been truthful. It's been out there. It has saved so many people. Stop wasting the time you don't have. Go and start your family today. Begin with acquiring knowledge. So many men are so ignorant. As I'm talking to you right now, they are watching soccer. They believe what they believe. After today, it's possible that drinking beer, it's possible that eating nkwobi, it's possible that not exercising, it's possible they no longer have sperm, but they are blaming you and you are being faithful. There are so many women that would have become pregnant if they had stepped out from their relationship. The problem is not you. You are putting your money in the wrong place. You are buying cars. You are buying houses. You are buying clothes. You are buying ashebis. You are doing things to impress people, but you don't have funds to go and seek help the right way, to attend classes, to get PDFs, to go for investigation, to see a fertility specialist. You haven't done the important thing you're supposed to do. You're getting ready to become a mother and you haven't named your babies. You are not ready yet. I'm challenging you today. You better wake up. We don't have the liberty of time. This is the moment you've been waiting for. I want you to change your ways. If you can change your ways, then you can give way, because our group is a circle of loop. When you're in BFB this year, next year you graduate, you enter ANC. You don't occupy the space of other women. You don't have any business being a believing for baby mother every single year. You have to vacate that place. That's not your permanent place. Your permanent place is motherhood. You might not like the tone of my message, but I'm telling you today that motherhood is your portion. This is your portion. Don't allow anybody else deceive you. Look, I'm telling you what I know. You are born a mother. The same way your mothers gave birth to you, you're going to give birth to your own. This is why I'm celebrating you today, because you're a mother. Regardless of what the time or the duration, I don't care. I don't care. What I care is what you're doing about it. Change your ways. Go and play this video. Go and have a family meeting. Put it in the big screen. Have a family meeting. Review. What have you done? My sister, by next month is 6 months. What have you done in 2021 for the 6 months? If God saved you in 2020 when so many millions died, what are you going to do? What are you not doing right? Are you still clinging on your own understanding? Are you still taking your clomid? Are you still trying to go to a place that will give you creature pregnancy when you don't know the right way? This is the opportunity you've been waiting for. Mother's Day is a big reminder. You don't feel bad. You don't feel inferior. If you went to church today, when they say mother stand up, you stand up because you're a mother too. You don't allow anybody make you feel inferior, because God doesn't make inferior products. You're still the daughter of Most High God. Do you understand what I'm telling you? Nobody should make you feel sad, my sister. Some of you have been crying. Oh, this person had this. Oh, this person had that. Have you asked yourself, what are they doing differently? There are so many women that refuse to cry again. There are so many women that say they're not going to become barren again, and they stepped up. You can start with adoption. You can start by yielding. You can start by convincing each other. You can start by loving each other again. You can start by taking your bold step today. You can. This is the day you've been waiting for. If you're not ready for action, you're going to be in the same spot. The problem is not asking questions and providing you feedback. The problem is action. Have you acted on what you've been learning? Have you changed your knowledge base? What about your attitude? Are you sowing seeds of faith? Some of us are so selfish. The only thing we want in this group, Dr. Chudi, answer my question, make me mother, and they disappear. I remember a particular lady that traveled all the way from Ireland to Nigeria. She's disappeared. When you get your babies, you come back and you help other women. When you're planning to become a mother, let me tell you the biggest secret. Nobody can be great alone. If you're a believing for baby mother in this group and you are blessed and you have extra, you better go and look for another woman who might not likely take care of herself, and you pick her up. I want you to be like Chiazoka. I want you to sow into people's life. This is a group of love. This is not just about you. Since you've been coming here, how many people have you powered? How many women that are needful have you had? Have you gone to motherless babies home? Have you given to other people? Are you just trying to get by yourself? What have you given for other people? I'm challenging you. I give my 1 hour every day. What about you? Do you know it's a tiny little thing that is preventing you from becoming a mother? Very tiny. Your faith. If you are good, God will definitely be good for you. If you help other people, God will definitely help you. There is absolutely nothing that can stop that. It's a law of nature. So I challenge you today. Go and get the services you need. Please stop asking questions related to the injection or drugs or prescription your doctor gives you. No good doctor can override your doctor's prescription. Someone is asking me about Zoladex injection. I won't be doing you justice if I tell you do this, do that, when I'm not your doctor. Follow the instructions properly. Very important. Stop shopping for drugs over the internet. It's deadly. Okay? Okay, guys, 6 more minutes. 6 more minutes. Let me see if there are questions I haven't attended to. Okay? And with PCOS stands for polycystic ovarian syndrome, an advanced age. Do you have IVF or can you have your baby naturally? Now, these are your 2 chances. You can have your baby naturally, but you have 2 factors: advanced in maternal age and polycystic ovarian syndrome. Those 2 factors can delay your ability to achieve pregnancy naturally. So this is what I will tell you. While you continue making love with your partner to see if you can achieve your pregnancy naturally, go and get ready and start your IVF immediately without wasting time. Now, depending on your age, if you're above 40, try and consider donor X immediately without wasting time. What drugs can you use to balance your hormones? My sister, see a gynecologist. Stop shopping for drugs, please. Okay? Doc, you had fibroid last year and you got pregnant, but you lost your baby at 9 months. Now, my sister, let's have a moment and think. Monturayo Fanokun, you had fibroid last year, right? Now, there are 3 different types of fibroid you can have. The ones we are concerned about are the ones inside your womb, intramural and submucosal. So you had it last year, you got pregnant, and you lost your baby at 9 months. This is a full-blown baby. I don't know what you have done. And you're asking me again, can you still get pregnant without delay? The right question is, what have you done to that fibroid? How can you lose your baby at 9 months and you haven't learned your lesson? What are you doing with the fibroid? 9 months. Full-blown baby. My people, come on now. How else can I say this so you will understand this? Do you know that most of our problems are preventable? Look at this lady. Last year, it's not even up to a year. I don't know what you've done to that fibroid. What you should be telling me right now is, Doc, I've done the fibroid surgery, I'm this, I'm that. Because when you have a big fibroid, it's a space-occupying lesion. You don't need to carry your fibroid when you're pregnant. You don't need it. My sister, do the right things. Please. What supplement to take when pregnant woman of 6 months, her PCV is 27. Now, if you're pregnant at 27, 6 months, do you know that a baby that decides to come at 6 months can leave? So I want to believe you have an ANC doctor and they check your blood, they discover your PCV level is low. Definitely they know what to do. So they will give you some blood, what we call hematinics, to build your blood. Because pregnancy is a condition that can lead to anemia. So your PCV being low means you're anemic. And anemia is not something you want to have when you're pregnant. So I want to believe you are consulting a very experienced ANC doctor. That's what you need. Don't shop for anything outside this arena. And why are you not in our ANC to start with? Now, what is the reason for paying peanuts to join other women, to have access to doctors directly when you're pregnant? Why will you come to my inbox and you ask me questions you could have asked me, we could have helped to save your baby? What are you doing? What price will you pay for your baby that will be too big? There is no amount of money in this world that can get your baby. Your baby is the biggest wealth in life. Do you understand that? So when you begin to mize on important things and you begin to allocate resources to things that don't matter, you're not helping yourself. You are outsmarting yourself. So all pregnant women, I'm begging you now, for your own good, go and register for ANC. Every singular woman pregnant, when you have done the dancing, when you have done the jubilation, the next thing you're asking the group, how can I register for ANC? It's for your own good. You've tried your best to target specific gender. You failed 3 times by getting gender you don't want. Please advise, you can subscribe. We can refer you to a provider that can, help. But here's the deal. Sometimes you do everything right and it will still fail. That's where God is God. But gender selection is important. Gender selection is possible, but it depends on the way they're going about it. There are specific clear-cut ways you can help get gender selection. So if you're interested, you can subscribe and we can see what we can do for you. Okay, I have 1 more minute. What makes a period to come 3 and 4 days earlier consecutively? Now, your period is not fixed. Your duty is to check your cycle and check the duration. Now, if it's 3 to 5 days earlier, but you still had a kind of a regular period, it's still within 21 to 35 days, then I'm not worried about it. This is where you have to know your body and begin to track your body and begin to track the trends. Now, whether your period is coming or is not coming, whether you're bleeding or you're not bleeding, what's your duty? So long as you're not bleeding, you keep on making love. That's your duty. That's the only thing required of you as a woman in this group. Okay, so thank you for coming. Dr. Ndiche is in the background. I want to believe she's also attending to all the questions. Dr. Ndiche is a co-provider, and you will be seeing her regularly in our Telegram group. So starting from next week, Dr. Ndiche will be going to the Telegram group every weekend, to spend at least 1 hour with the two members in the two platforms to interact with you guys. Then I'll also come in and we'll look after you guys. Okay, now her clinics comes up on Tuesdays and Thursdays. So if you come to our group and our page on Tuesdays and Thursdays, you're going to catch up with Dr. Ndiche. Dr. Ndiche is also going to be part of the panel for the multiple pregnancy roundtable. You do not want to miss this. Okay, guys, my time is up. Thank you for coming. Please remember you're a mother. Please, I know I've been sweating. It's very cold here, but I've been sweating. I've been shouting. I've been doing stuff. It's because I love you. I want you to change your ways. There is nobody in this gathering today who cannot become a mother. There is nobody in this gathering today who was born barren. You are born a mother. You can become a mother. You are possible. You can have one. You can have two. You can have three. You can have four. Yes, you can. Do you understand that? So challenge yourself. Pick yourself up. Stop crying about it. Do something about it. And let God be God. Thank you for coming. If you love this group, if you appreciate what we do, share the group. Copy the page. Tell it to your friends. Come, let's fellowship. Share it in Facebook. Share it in YouTube. Share it with anywhere you love. Share with your friends, your brothers, your sisters, your colleagues. Everybody is welcome. Thank you for coming. By this time next year, I want you to stand firm. When they come others, you stand with your own babies. It's going to happen. It's going to happen. So thank you. And please, let's remember our PPP. When you have prayed about it, please make love to and love your love making. Make it fun. Now, when you have done your best and your best is not good enough, you say, God, I thank you. Now, God, lead me. God, show me the way. God, show me the right doctor. You begin to activate your faith. You don't stay in your place and you're waiting for God to come for you. No. You move. You move when you can. But remember, there are so many ways you can become a mother. So many. So many. Fertility treatment, IUI, IVF, donor X, donor sperm, surrogacy, adoption. You can see the list is endless. Start your family today. Starting your family is a choice. Banish that thought of getting clean to your culture, to your religion. My pastor this, my pastor that, my nonsense this, my nonsense that. This is your life. This is your future. This is your generation. Get up and do something. Get up and actualize what God has already answered. Most of the prayers you've been praying, God has already answered them. Thank you for coming, and God bless you, and enjoy your Mother's Day. You rock. I'm so proud of you. God bless you, and bye-bye for now. I'll see you guys tomorrow. Remember, tomorrow is our Believing for Baby Open Clinic. So if you're not in the group, please follow the admin. Make sure you go to the group. Make sure you go to the page, and I'll see you guys tomorrow. Until I see you, God bless you, and enjoy the rest of your weekend. Bye-bye for now.